causes of cancer that are concerning women.
I think you ought to have a colonoscopy when you're 50. You at least do stool samples for blood, but a recent study showed that that's really not that accurate. So the best thing to do is to have a screening colonoscopy.
If a woman has a family history of colon cancer, you may recommend the screening at a younger age, particularly maybe 10 years younger than the age of the person in the family that was diagnosed with a colon cancer. Breast cancer, if you have a lot of family members with breast or ovarian cancer, you may want to do the ovarian screening starting at an earlier age, and the mammograms to start with the first screening between 35 and 40. And these people are definitely more important on the self-breast exams and their routine screenings when they do tend to have a family history of cancers that are clustered in the family. We also can't forget that women are getting lung cancer at a higher and higher rate, mostly because of the increased amount of women who are smoking. Women who smoke should have a chest x-ray on a routine basis determined by their physician and their other risk factors to help in the screening for this.
Men need to have a prostate exam. They should have an exam, and there is also a very effective screening test called a PSA, which will help detect prostate cancer. And you need to have that when you're 40. The University of Kentucky has a screening program for ovarian cancer.
In the last 30 years, we've had access to women's health care that has been very good in the form of health departments and other federally funded organizations who provide health care to women at free or greatly reduced costs.
What I would suggest is you go to your family doctor and tell them you want a good preventive medicine checkup. And most of the time that would involve a physical exam. It's easily done in the office. Some blood work like the PSA is just a simple blood test, easily done in the office. The mammogram is basically an x-ray. And then the colonoscopy it's an outpatient procedure. You're not admitted to the hospital. It's definitely an inconvenience, but none of these tests are really too troublesome or painful, and everything should be organized through the family doctor and get it all done.
So what people need to do is call their moms, call their grandmothers, so that we can get this screening and prevent them from dying and prevent them from having pain and suffering from these cancers when they present in the advanced stages.
Hello, my name is Jeff Brown. I wrote the following song in tribute to my sister Tammy, who recently lost her battle with cancer. As the song states, there is hope of a better life when we leave this earth. But we want our loved ones with us here as long as possible. So please, take time to have your regular cancer screenings and ask your doctor those all-important questions. Do it for those you love and for those who love you. I watched an illness take a loved one from our home. Sometimes life just ain't fair. She made reservations, and I know where she's going. There's no cancer waiting there. As we gathered round her, and we knew the time was near, we watched her slowly slip away. Such a peaceful feeling came into that room, and I could almost hear her say, my struggle's over, I'll fight no more. I lost the battle, but I won the war. The victory is sweet as I bow here at his feet. Don't weep for me. Oh, if you could see, I'm forever free.
I would certainly recommend that a person get after it right away.
It's very, very important that they find this early.
Get it done, and then you'll have that peace of mind that everything's okay. And then if everything is not okay, it's early enough that it can be prevented, like mine was.
I know it saved me from probably something much more serious than what I had.
You need to know those symptoms and watch for them, and then get screened, and then immediately get help if you find out, of course, you have cancer.
You know, there's a lot of different kinds of cancer, and we can have it a lot of different places. But I can tell you right now that I have lived having had a radical mastectomy for 32 years, and I feel very comfortable with it. And I feel comfortable that I've helped others to see the importance of it.
There's a time to laugh and a time to cry, time to live and a time to die. You know that's something that everyone's gonna face. But if we live our lives in Christ, we'll keep the faith and fight the fight. When it comes our time, we can say, my struggle's over, and I'll fight no more. I lost the battle, but I won the war. The victory is sweet as I bow here at his feet. Don't weep for me. Oh, if you could see